Hey guys, it's Leah Buckles from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former CMP examiner. Today I want to come on and discuss chronic fatigue syndrome as it relates to Gulf War exposures. This is something I get asked about quite a bit. We've done other videos on chronic fatigue syndrome in the past, just in general, but today I wanted to focus in on those of us who have deployed in support of operations in the Middle East in the areas that are considered presumptively related to Gulf War exposure for this condition. So let's talk about what chronic fatigue syndrome is, okay, as a definition. So the Center for Disease and Control defines chronic fatigue syndrome as a condition, as a syndrome that includes severe fatigue lasting longer than 6 months, as well as the presence of at least 4 of the following physical symptoms: post-exertional malaise, unrefreshing sleep, impaired memory or concentration, muscle pain, polyarthralgia, sore throat, tender lymph nodes, or new headaches. It is a clinical diagnosis. And what does that mean? That means that there's not a specific test or imaging study that's going to say, yes, confirm it. You have this. It's a constellation of symptoms that you're going to be diagnosed with based upon you meeting whatever the specific criteria is that I just kind of went over. Also, it's really key to understand that it has to be, the diagnosis has to be made when all other processes, disease processes, are excluded. So for example, if you have sleep apnea is a big one, or a thyroid disorder or cancer or something like that, and that's causing you to be fatigued because you're going through, let's say for cancer, you're going through radiation and you're tired all the time. Well, your fatigue is related to cancer and the radiation treatment. Or if you've got sleep apnea and you wear a CPAP, or maybe you haven't been wearing your CPAP and you're tired all the time, well, your fatigue is probably related to sleep apnea. This is one of the biggest things that I get questioned about a lot. And that doesn't mean that you can't get service connected on a secondary basis. I don't think that, personally, I don't think that that meets the criteria based on what I just read off. You have to exclude other conditions. Otherwise, your fatigue is just a symptom of another condition. And so for you to actually have chronic fatigue syndrome, other things have to be ruled out. Again, there's not an always or never. So I think it's important for you to always follow up with your own private treating doctor. I'm not providing any kind of medical advice, and your legal professionals, right? So then let's talk about Gulf War illness in general. So I don't want to get into the PACT Act today because there's a bajillion questions about the PACT Act that just got released. I think it's awesome. I think we're going to learn more and more about that and see different types of cases get connected as time goes on. But Gulf War illnesses, you can head over to va.gov and there's some good information about that. So eligibility requirements at the time of diagnosis. So if you have had the illness for at least 6 months, we already talked about that's part of the diagnostic criteria anyhow, and the disability resulted in a rating of 10% or more, and you have one of the following presumptive conditions. So functional gastrointestinal disorders like IBS or dyspepsia, chronic fatigue syndrome, which we're talking about today, fibromyalgia, and then there's other undiagnosed illnesses. There's a myriad of them. There's also some conditions related to service in Afghanistan, but we're not going to talk about those today. So what areas are included? There's several areas that are included in Southwest Asia. So we're talking about Iraq, Kuwait, Saudi Arabia, the neutral zone between Iraq and Saudi Arabia, Bahrain, the UAE, Oman, the waters above and the seas around, and the air above. Sorry about that. And the Gulf of Aden and the Gulf of Oman. Okay. So those are the locations. And I think it's going all the way back to 1991 to present day. So moving on, if you've got that condition, you meet that criteria, you can very well be service connected for it. There are some other things you can show aggravation or relationship to for other conditions as well. I have another video you guys should check out about chronic fatigue syndrome just in general, if you want to have information on some of that. And then what to expect as far as ratings and as far as the CMP exam. We can do another video on that, but real quick, let me pop over to what the DBQ looks like. Hang on 1 second. Okay, here's the DBQ. You can go find this on va.gov, go over it. So you can understand what to expect in a CMP exam. They're going to go over this document. Again, I'll do a later video about what to expect in a chronic fatigue syndrome CMP examination, but just for your situational awareness, you can go pull this up over on va.gov or any other DBQ of your choosing. So I hope this was helpful, guys. Please let me know if there are any other videos that you would like to see. The ratings for chronic fatigue syndrome are definitely things that you can look up, and they're in the 38 Code of Federal Regulation. When we do that chronic fatigue syndrome video, we'll probably talk about the ratings as well. I hope this was helpful, and please let me know if you guys have any questions. Thanks a bunch.